Hello, this is Neil Baum from New Orleans, Louisiana, and I'd like to take a few moments to talk with you about enhancing the productivity of your practice by reducing the number of no-shows to your practice. If you look at the needs and wants of most American urologists, it's shown in this slide, and I'd like to call your attention to the last bullet, and that is the importance of increasing the efficiency and productivity of your practice. This video will discuss the concept of why no-shows occur, how to identify which patients are likely to be no-shows, and several solutions to reduce the number of no-shows within your practice. There's a difference between no-shows and cancellations. Cancellation is a patient who contacts the office and allows you to reschedule them and allows you to fill that time slot that they are leaving open. A no-show is a patient that does not call the office and can leave large holes in your scheduling program, which can be very costly. For example, if you assume 2 no-shows per day and each no-show approximating a loss of $100 per patient, that's $50,000 per year that can be lost to the productivity of your practice. That number is even greater if you're considering procedures that are canceled without contacting the office, such as cystoscopies, bladder biopsies, or urodynamic studies. It's important to identify the source of the problem. I recommend having someone in the office call the patient and ask why they did not keep the appointment. You will find that it is common for patients who are given appointments more than 4 weeks from the time they call for an appointment are likely to find another physician for their urologic needs. And I think it's important that at least on a quarterly basis, you monitor the trends of no-shows in your practice. So who are the no-shows to a urologic practice? Usually they are self-paying patients, patients with emergencies and urgencies, and if they can't be seen within a reasonable time, they will go to an urgent care center or find another urologist. And again, patients who are given appointments, particularly new patients, more than 4 to 5 weeks after they request an appointment, have a high risk of being a no-show patient. So what can you do to solve the problem of no-shows? Well, one is have a practice policy that's in your patient brochure or on your website, indicating the importance of keeping their appointment and what penalties or charges that are going to be incurred if they fail to notify you within 24 hours prior to their appointment. One solution is to keep what I refer to as a sacred time slot. That might be one time slot mid-morning or late morning and mid-afternoon that are kept open for new patients, urgencies, and emergencies. My goal or objective was to see any new patient within 3 days of their request for an appointment. By keeping these open slots available, you can usually accommodate most new patients. Another option is automated reminders, which is a software program connected to your practice management system that notifies patients 24 hours before their appointment and gives them the option of confirming, canceling their appointment, rescheduling, or leaving them with a message. The cost of these automated appointment reminders is approximately $100 per physician per month. These reminders should be able to interface with your electronic medical record program. Here is a list of some of the most popular automated reminder systems, and I recommend that if you are considering using an automated reminder system, that you contact several of these software companies and check out which one meets your objectives. Now the question is, should you charge patients for no-shows? Many practices say they charge for no-shows, but not actually following through on trying to collect for no-shows. My recommendation, if you have a chronic repeat offender, approximately 4 no-shows, that you send them a letter notifying them that you can no longer accommodate them as your urologist, and give them an opportunity, usually about 4 to 6 weeks, to find another urologist. The question about charging for no-shows, these are difficult fees to collect, and it does create ill will between the doctor and the patient. However, if you decide to institute a program for no-shows, you must have the patient sign an agreement informing them that you are going to charge them if they don't cancel or request another appointment within 24 hours before their scheduled appointment. Here is a sample of a no-show or late cancellation policy, which you are welcome to copy and implement into your practice. So what's the bottom line regarding no-shows? It is important that you be proactive in looking at these no-shows and check your access in your practice for new patients and urgencies and emergencies, and can you accommodate them without wreaking havoc on your schedule. Final message is, by reducing no-shows, you can improve the profitability to your practice. If you would like additional reading, I recommend the Definitive Guide to No-Shows, and it is available on the link that I am showing you on this slide. Well, I hope you have found this video helpful and useful regarding no-shows. If you have any comments, suggestions on how you manage no-shows in your practice, kindly let me hear from you. Thank you.